everyone. Welcome to another episode of the Doctor Suit, the podcast where we sit across different stakeholders of medicine and get a 360-degree perspective of healthcare. We're Sharan and Mohit, and today we have one of my oldest friends, Mr. Maitrey Prajapati, as our guest. Maitrey is pursuing a master's in architecture from UPenn, one of the most prestigious schools for the discipline. A little bit about him. Maitrey is a polyglot by any measure. He cooks, codes, writes, and plays at least three instruments. In my view, these skills serve him greatly. You see, architects look at buildings from so many vantage points, drawing inspiration from art, history, culture, and the sciences. And Maitrey's ability to weave them and create something spectacular is why either you know him already or you will in the coming few years. So, Maitrey, it's really nice to have you here. How are you doing?
Thank you so much, Sharan. Thank you so much for that amazing introduction. I was very generous, I must say. I'm doing quite well, and it's a pleasure to be on this podcast. I've seen the amazing work and the conversation that you have here that touch across disciplines, and I think it's important to bring into context that discipline and healthcare and the work that you guys do is not necessarily a single it should not be looked at through a single discipline approach. There's many things that go into health. There's many things that go into taking care of people. And the more we talk about it, the more we bring diverse perspectives, the more we learn, the better we get across the board. And so I'm happy to learn and talk here.
That's actually a
Absolutely. Yeah.
fabulous point you made because there's so many interconnected roles in healthcare. And how do we get a bird's eye view? How do we really improve and save cost? That becomes a very essential component over here, Sharon.
Anyways,
Yeah.
yeah. So that's great. I think we're all on the same page. And I think before we dive in, I'll just let the audience know we're going to be talking about smart hospitals and smart hospital design. And so, can you Eli five for us? What is a smart hospital? Like, just give us a general 5-year-old level introduction of what a smart hospital is and how it functions.
Mhm. So when I talk to 5-year-olds, I talk in circles and in stories. So let's do that because the thing is, there's many aspects of what we call as smart hospitals.
Right.
And the first thing that you will think of it when you use the word smart hospital is something that's imbued with, high technology, AI, medical imaging, and that's the kind of those are the buzzwords, those are the high tech research that's going on across the world right now as we speak. Those are the smart things that are usually taken for when we think of that word. But then there's other things that are really not so smart as much as common sense, as much as good design, as much as good logic, and as much as good experience that we've gathered across millennia of thinking about how to take care of people, how to take care of health. And when these principles are applied in the creating of spaces that enable you guys to do your work, that enable us to get better, uh, that's what I call the beginnings or the first aspect of smart architecture, smart hospitals, because you can add those other things. The thing with the high technology and the AI and the medical imaging, and as I was like researching for this thing, I came across how there's companies like IBM and everyone who are doing insane amounts of research. They're putting in like machine learning and everything for uh, for hospitals and surgeries and all that stuff. So that's all great, and we need that. We need those advancements. But the thing with those is what I believe it's not very equitable in terms of access in like across all regions of the world. So like when we think of places in India, when we think of places in Bangladesh, Ghana, uh, there's much more need for simplicity of smartness rather than the high tech like version of smartness. So I would say a smart hospital in the context of this conversation is something that looks through many ways in which to provide a better way of care through simple design choices.
Too simple as I think so. It's a much more grounded version of the word smart because I think smart now just anything everything is smart. Like you have a smart refrigerator, you have and everybody's making things smart whether without asking do you actually need it. And as you said, I think there is a need to integrate technology as well, but then there's also a need for basic design principles and that's something that we can all work on,
Yeah,
and that impacts everybody.
that's absolutely
Right.
right. What do you mean by exactly basic design principles in terms of from an architecture or doctor's point of view? I mean, when you're designing a hospital in terms of basic smartness,
Mhm.
if you could.
Mhm. Um, let's talk about yeah, that's great. Let's talk about the basic design principles in terms of just smart design principles. When you think of, say, when I'm holding this mouse that I use, there's many aspects of this that make it comfortable and sometimes not. You guys probably know that using mice leads to carpal tunnel syndrome in the long run. People like
Of course.
me who spend a lot of time doing, labor work on these computers. And the way this mouse is designed, it's designed in a way that way my wrist sits on it, it prevents or sort of delays that process. That's a smart design because it took a bit of forethought on the part of
Mm.
the person who was thinking this. It took a bit of labor in changing it, not too much, but what that led to is a lot of healthy life on the user's part, right? So, and that's such a simple thing. It's just a mouse. There's so many consequences. There's so many. If we'll go a little bit back, there's so many consequences how our mind is basically affected by things like these little things like light and shadow
Right.
and the quality of space that we inhabit. And so when we think about those, when hospitals are thought designed by using and just being careful towards those things, it leads to really good hospitals. And so we'll step back into the past where you guys must have studied about how humans have been treated throughout history. And what
Yeah.
one important part of treating humans was, going to places that are imbued with nature, that have good
Right.
sunlight, good air. The whole concept of miasma, bad air, and all those things. We did not know about germs and everything, but we still knew about the concept of good air and good sunlight and all those things. So we knew that these things are important, and these used to be the places that people go to for good health, for medicines. Now, what happened, and we knew that, but what happened in the past century is that with the rise of you know technology in its rudimentary form, we started chasing functionality, not just in
Mm.
hospitals but in everything, in schools, in buildings, in houses. And that led to, in hospital design, that led to huge blocks, big towers, long corridors, small rooms, fluorescent lights, beds crammed together. That really wasn't the smartest. That really wasn't the
Of
smartest.
course.
Nobody thought of whether this is a smart thing to do for making a good patient room. They just started making a functional patient room.
But I
So
guess
it's
that's
those things.
I guess I think the priorities changed, right? Because it went from, okay, I want to take care of the patient in the best way to like how many beds can I cram into this, space?
Mhm.
And how do I make it run more efficiently? How do I increase the turnover? I think that becomes a priority. And I think looping it back to where we started, I think you just gave a really cool definition of the word smart, which is before you're tackling a problem, you're kind of applying forethought, looking into what can you do better and what problems you can come across, and then how do you tackle those problems by design and prevent them from ever coming up. I think if we were to define smart, I think that's a good definition. Would you agree?
Yeah, definitely. And yeah, there's many levels of smartness, and we need to start with the base one because we are assuming,
Right.
in the context of Indian hospital design, in the context of
Right.
any global center, let's focus on principles that are applicable everywhere, not just in
Across
the
the
rich
board.
countries, not just in big universities, across the board in simple villages. And so it's there you have to be really smart about what you mean by smart, right? You cannot.
Absolutely.
Right.
Absolutely. So I think I guess I'm a little curious about this as well. You talked about the impact of natural light, and you talked about the impact of good air, I guess, and just being in nature and how that impacts people. So, can you tell us a little bit more about why, on a very intuitive level, we understand that being in a cramped room, being claustrophobic, being surrounded by buildings is not good for you, and you feel better when you're in nature. But can you like sort of elaborate on how when we're talking about smart hospitals, for example, can we elaborate? Can we sort of incorporate those concepts into designing hospitals that are much
More
um,
concerned.
better suited for humans? Yeah, much better for human
Mm.
beings in general, like not just
Yeah,
people, not just numbers on a paper, but for human beings.
yeah, for sure. So like hospitals, because right now we think about how in across the world in different ways, and let's start with something very basic. You want to feel comfortable. So when you think of hospitals, when people think of hospitals right now, what do you think? 'Cause you guys have been in hospitals more than anyone. What do
Yeah.
you think? What comes to mind? What is the environment like in the hospitals that you worked at, the big hospitals in Ahmedabad or in other places? What is the environment like?
Mohit, I think
The
you can start.
environment, it really varies from country to country, right? So people generally don't like visiting the hospitals because they have a predominant belief in their mind it's for the sick. So
Mm,
from what I have observed, uh, current hospitals, like the ones that are focusing on, let's say, medical tourism, are converting to that different model where they come as a hotel.
Yeah.
yeah,
It becomes a
yeah.
hotel.
It's funny. Yeah, it's great you mentioned hotels because what's the term for hotels? It's hospitality. We've separated hospitals and hospitality, which
Oh,
I
that's nice.
when that happened, I don't know, but whenever it happened, it was a bad thing,
Yeah.
because
Incredible.
yeah,
Incredible.
when
That's
you
a
walk
nice
into a
thing.
hotel lobby, that's so different, but we think of that as hospitality. When you walk into a hospital, it's
It's
ugh,
different.
yeah.
In fact, when I was rotating at Methodist, the doctors used to be like, "Welcome to Hotel Methodist." So, but
I think,
the
but I
problem what
think,
I've realized is this has actually resulted in severe increase in costs for patients. Now, how smart it is at the end, right?
Mm,
but again, I think that's a very good point because, like you said, there are two. I guess there are two different worlds when we're talking about what kind of hospitals we're in. So, when I was rotating at suppose a hospital like Shadaban General, which is it's a government-run hospital on the eastern side of Ahmedabad. It's cramped. There are so many patients. There's no space, but it's extremely busy. And at the same time, when you look at a hospital like SVP, or you look, as you said, Houston Methodist, or any of the
Or
big corporate hospitals, they're designed very differently, but they also cater to a different population within
mm,
this. They cater to a different cohort of the population as well. And so I
mm,
think that's what I loved about your definition of smart. That if you can use principles that impact health across cohorts and across
mm,
socioeconomic divisions,
mm.
I think that's something that we can really look into. But yeah, please go on.
Yeah, absolutely. And so that's when we move forward with this topic, we'll explore some hospitals across the world that have been created in really like in villages across the world in very poor economies, and these employ the thing because there's there's Princeton, like Plainsboro, and there's the Shadaben. They
Right.
cater to different people. There's different sort of intensities of work that goes on there, but I feel like there's something in the middle zone where you can learn from both of them, and then you
True.
can deploy it at places that need it the most, so that we in this current world there's no I feel there's no need for exclusives. You can have both, and you can have it in a simple way. It's just you need to think about it more, and you need to spend some more time in designing that, but you can achieve both of that, and we'll go through simple examples to that. And so
Yeah, go
yeah,
on, go
yeah,
on.
please.
So basically, back to what we were talking about. So how do you think? Can you elaborate on like how do these different elements sort of impact the patient on a very personal level, and how do you incorporate them into a smart hospital? I think that's what I wanted to know.
Absolutely. So as we said, like an hospital is not a happy place to visit because of historic connotations of illness and disease and how society views illness and disease, which is cyclically
Yeah,
also because of how these hospitals are constructed.
right.
But sort of research has shown that patient-centric design is a positive, and making it a positive experience of visitors is paramount. Now, how to do that
Right.
is what you're interested in, right?
Right.
And it's through things. So I was thinking about, so in ways where I was reading through material that says how we can design spaces of healing and rejuvenation instead
Mhm.
of treating illnesses, right? Places treating illnesses, right? You're having a shift of you're not just treating illnesses, but you're healing people. And when you think about
Right.
that, you'll think about how to reduce negative experiences and the stress that comes to visiting a hospital. So first of all, maintaining a non-clinical atmosphere is extremely important in outpatient areas, right?
Mhm.
When you walk into the hospital, you want to have a nice lobby, which has some lighting, which has good seating spaces. You want to feel welcome. You want that sort of the sense of hospitality back into a hospital, so that people are not intimidated by the experience. They don't feel ashamed that they are here in a hospital,
Yeah.
but they feel good about it. They're here to get cured. Natural light is paramount. And so just going back, like as we were saying, hospitals are bad. What really changed in the 90s was this seminal paper that came out that showed that let me remember the name of the paper, but I don't think it's important. That showed that nature is extremely important to health,
Health.
and it was an 80-year-old study that they did, and that really changed on how design professionals and how especially how healthcare professionals think about the inclusion of nature in hospitals. So it's as simple. They found out something as simple as there being a painting of nature or a photograph of
True.
nature is something that really reduces stress in people. It's something as simple as that.
Incredible. That is that's not it. That's not an insight that physicians are gonna have. Like, because for us, it's like here's a medication to make you feel better. Like, here's a painkiller. That's what we're gonna be thinking about. But then if you can have a similar intended effect or even like an effect on reducing the stress of the patient, as you said,
Hmm.
by incorporating things like this, or putting a plant in the room, if that makes a difference in some way, I
Hmm.
think as you said, as doctors, we're not just treating the disease, we're also looking at treating the person. And we want to make
Hmm.
sure that um, they feel better overall, it's not just that particular disease that we're, curing. We're also trying to make sure that the person walks out of the room feeling better overall.
Yeah,
Hmm.
yeah. And as we see like the current trends, they're actually moving from treating the sick to actually incorporating well-being into it. Like several,
Yeah.
if you've realized in the past 10 years, the well-being market has skyrocketed. But
Hmm.
now they're looking at to integrate the well-being market with the clinical market itself.
Hmm.
So I'm just curious to understand how can eventually holistic care be approached in the whole setting. Yeah.
That's an interesting notion. Actually, I want to get your opinion on it because I feel there's a I feel the well-being market is an amazing thing, but it's in the context of hospital design, it really big. What you guys want to do is take care of people in the short term, and the
Yeah.
well-being market is for the long term
That's
of the thing.
interesting.
And so I
That's
don't. I
very
think of
interesting.
when I think of hospitals on a large scale, I think of people staying there with the short term. You want to keep them stable, and then they're out of there. The well-being market, on the other hand, is more of the sort of the middle zone between hospitality and hospitals, where you think of long-term care, where you think of hospice, when you think of like supplements and other things, and it's so crazy when you bring that equation into the mix. And they are really focused on the hospitality part of it because the I feel, as Mohit said, the well-being
Mm,
market really understands those aspects more than the hospital design like field, which
yeah.
now they do, but like basically in mid-century, we did not.
But that's never been the priority, right? Like that's the thing. It's the hospice market. The priority is hospitality at its best. You're trying to make the patient comfortable, and then
Hmm.
we're trying to draw concepts now
Hmm.
from that domain and sort of kind of apply those principles to hospitals in general. But I think
Yeah.
you brought up a really cool point that patient, when you envision healthcare or when you envision hospitals, you think about patients being there for the short term, right? So I think that kind of leads me into my next question is when you think about smart hospitals, do you design them for patients or do you design them for the people who are going to be working there far longer then the patients are going to be there. So like a patient will come in, get a surgery done, and be out the door in 7 days. And you can do as much as you can for the patient, but then there are also doctors and nurses and staff that work in the hospital. And what kind of smart design principles can you apply there to kind of make their life easier? And if you can give me an example, like if something that's been happened.
And I just
That's
want
a
to add one more question to this. Now, for instance, if you're designing for a rural area, a hospital, or let's not say rural area, a urban area in India, so they
Mhm,
want to really prioritize on effective but low cost care, right? How do
mhm.
you achieve the same economies of scale that
In the same, yeah.
same and also
Yeah,
cater to smart hospital design? Adding to
yeah,
Sharan's questions as well.
Yeah, these are two fantastic questions, and I think we can address these through comparing and contrasting two examples of hospitals
sure.
that exist in different parts of the world that cater to different segments of society, and they are widely different in how they're conceived and how they function. But I think in the middle of both of these, we'll have some sort of understanding on what to put. So it'll be a long thing, so bear with me. Um, it's
Go on.
Sharon brought up. So what you brought up was the part that what a hospital is designed for, right?
Yeah,
And we we found that 50 years ago they were designed for efficiency. They were not designed for anyone, not for staff, not for the patients. Now I feel good hospitals are designed equally for the staff and for the patients, because when you think of the staff here, they also want to serve the patients, right? So if they
yeah,
are kept happy, if they're kept,
exactly.
if you make their job easier, you make the patient job easier. And this will be very interesting to you guys. I just found a study
Mhm,
that was done by the study was done by Mass Design Group in conjunction with many hospitals in the
mhm.
United States, and they talk about something that's related to pediatric care. So I want to ask you, there's you know or this is what I know from a reading, but you can check on me that there's really, when you think of like deliveries, when you think of normal deliveries, and when you think of cesarean deliveries, there's a very sort of a gray area where people can choose to have cesarean deliveries, and this is something that they wanted to see. And what do you think? Like, so in your experience, what is the percentage of a normal delivery or a cesarean delivery on an average in a gynecological clinic,
I mean,
like in
it
the
really
country?
depends on, I guess it depends on like where you are again, because a lot of people, um, you know, cesarean deliveries have gotten much better in the last few years. And so a lot of people tend to get elective uh, CS done just so that they don't have to go through all the pain and everything. But
Hmm.
I mean, I honestly I would not have an accurate estimate of the data on me at the moment. I could probably look it up and give it back to you. But
But
I think what you're essentially asking is not if there are no medical indications for an elective for a cesarean delivery. You're basically asking w- how many people choose to get an elective surgery, elective CS, and how many people choose to get it done naturally. I think that's the crux of what you're
what
asking me.
what would you say if I told you it's a function of how the maternity home is designed? It's
That's
simply a
amazing.
fact of its floor plan, which is crazy to me. And I just found it out today
Unbelievable.
when I was looking at it. So bear with me. They found that across the US, the rates on cesarean delivery vary dramatically from hospital to hospital,
Right.
from a 7% to a 70%. And that's insane,
Unbelievable.
right? That's why would that happen? So they were very curious about this. So they did a mixed methods descriptive study of a dozen
Mhm.
hospitals and birth centers in the US across the country, and they employed quantitative metrics. So the distance between the labor and delivery rooms and the surgical rooms,
Rooms, yeah.
um, the
OTs.
size and shape of the delivery unit, and then how the staff is located,
I
right?
see.
So some other metrics included the ratio of operating rooms to the number of delivery rooms. And then they took this thing and they studied different hospitals. So what they found out that where sort of, if there's many operating rooms in a hospital, if the ratio of the operating room to the delivery room is high, the staff elects to
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 get it
do a
done
cesarean
easily.
operation because it's
Of
easier,
course.
right?
Of course. Yeah.
If the surgical rooms are closer to the delivery rooms than a hospital where they're farther away, the staff would do a cesarean operation. So really, as a woman, if you are giving birth and you go to a hospital, the
Yeah.
chances of you getting a normal pregnancy like delivered or a cesarean delivery really depends on the floor plan that the architect drew to a large extent, because that's how the psychology of the staff operates in the space that they work in, which is
So,
insane because
Mohit, can you imagine doing like a research paper on elective versus like medically indicated CS, doing it in a hospital, doing it in one hospital like this, and then doing it in another hospital, and then we would have all kinds of medical justifications of why something is happening, and we would have never thought that
Yeah.
maybe the floor plan also has something to do with what's going on. So
This
this is why we need to talk to people outside of medicine.
Yeah, yeah,
You
this is
know?
mind blowing. Because we as humans have this ease of doing things faster. So we will obviously choose the
absolutely.
most convenient route,
All right,
right?
yeah. So please go on. I'm sorry to interrupt you, but yeah, this was
No, no, that's
incredible.
great because I had the same experience as you. You probably have a more visceral reaction to what I do because you guys must, you never thought that this happens, right? And basically neither did they, but they found this data and then they wanted to see what had happened. So I guess that there's a big correlation, and this is a big thing. There's a big correlation on how design in the end leads to how the staff cares.
Right.
It's also a simple thing as in one hospital. Most of the spaces are collaborative spaces for
Hmm.
the staff. So basically for the nursing and the doctors and everyone. And in another hospital, like that they did, say there's all the nursing stations are very separate from each other. Now they did that
Right.
architecturally, thinking that let's place one nurse to every four rooms so that like the patients will have good access to the nurses and easy access. What that
Hmm.
happened was all the nurses were separated from each other. Their stations were far apart. That did not
Uh,
lead to good collaboration between them. That led to them not able to talk to each other about the patient. That led to them not having a downtime. That led to lower quality of patient care because the architect thought something
Incredible.
and he did not think it through.
So you guys are basically practicing psychologists as well. I mean, you
Yeah.
have to have. I mean, you have to look. I mean, like I said in the introduction, I think architects need to look at things from a lot of different vantage points, but then we never think of architects as thinking about the psychology of the people in that space. And I think what you brought up talks about tells us how important that angle or that vantage point is as well. You're
Mm.
also designing how the people functioning in the space that you design are going to feel and are going to, experience how their experience is going to be. You're kind of designing that as well.
Yeah, and that experience is very paramount because Mohit and Charan, as you guys know, that the delivery of medical care is extremely labor intensive.
Yeah.
it the amount of patient to staff ratio is very high in inpatient facilities, and it needs to be there, right? Because care is very intensive. It's a very labor intensive process,
Hmm.
Sure.
and the range of staff of professional and service staff is extremely
It's
high.
insanely low.
So
Yeah.
you have to make sure that they are happy,
Hmm.
they are able to do their jobs in the best way possible, and good hospital design would do that. So I'll give you an example.
Yeah.
So on the campus that where I am, like here in the University of Pennsylvania, they unveiled a new pavilion, which is a state-of-the-art hospital for emergency care. It's
Okay.
a massive building done by one of the most famous architects in the world, Sir Norman Foster, and it's called the Penn Pavilion. It's
Okay.
it's a multi-billion-dollar project. Now, what they did is they had all the money in the world, so they had the privilege of doing all sorts of research. So they literally researched with the Penn medicine staff for many years. What they did is when they made the floor plans of
Hmm.
these of one plan, they rented out a huge warehouse and then they taped all the walls and all the beds, and then they wheeled
Hmm.
in all the beds, they wheeled in all the units, all the incubators and everything, and then they got all the staff who would be working there, and then they did a dry run of everything. What if there's an emergency
Unbelievable.
process? What if on like dummies? or not dummies, real people who were just acting, who was also the nursing staff and the doctors. So in these ways, then the team took their feedback, went back to the drawing board, changed stuff up, came back again, did the whole thing again, did this for 2 years. And they came out with the most efficient plan possible for the
Wow.
staff. What that did is that created the most amazing hospital for anyone who's a patient there, because you know that the staff in there is very happy. They know exactly what to do, and that hospital is designed exactly how the staff wants.
Interesting.
So it's
Art and science. Art and science. That's like a marriage between art and science right there. I think you.
and so that started with the collaboration between a lot of people, that like what
Right.
we are doing here, right? It's you have to
Exactly.
start conversations. And one of the things that came out of it was modularity in design, which I'll explain. In hospitals, when you are doctors, you go to a lot of rooms.
Right.
Nurses also go to a
A
set of
lot of rooms.
rooms.
Yeah. Yeah.
Um, there's different floors in a hospital, there's different types of rooms. Now what happens is that the beds are oriented in a certain way, the bedpans are there in a certain way, you have stuff in the room, right, in every
Right.
room.
Sure.
Now if you are a doctor, if you are a nurse, you have to remember, or you have to look for things when you go check on a patient. What they
Right.
found out is that they designed every room in the exact same way possible. So if you think of how hotels and these things are designed, they're basically designed in a mirror across a wall. So basically rooms
Right.
are mirrored across each other. They found that
Got it.
that was not efficient for the staff, because you have to, there's something called muscle
Keep in
memory, as
mind.
you all know. You have to,
Right. Right. Right.
they
Something.
wanted everyone to be so precisely sure of where everything goes without even thinking about it. Every
Right.
single room is designed in the exact same way. So if you're a hospital or if you're a nursing staff, you go to any room in the hospital, any room, no matter what, everything is there in the exact same position as it is in anywhere else. So that makes you focus on the person then, right? Not
Right.
how to navigate what you do. And that's what you
Impressive.
and that's what you want to do.
Decrease
Impressive.
the
Impressive.
cognitive load
Yes,
of a patient
absolutely.
navigating across a hospital. Again, there's so many hospitals that are coming out which are massive, looks beautiful, but then it becomes very challenging to navigate, and that that becomes a problem.
Yeah. But I mean, okay, so I guess this is one end of the spectrum that you talked about, which is like when you have all the money in the world and you're like, okay, do what, this is the ideal scenario where you actually have like iterative research, iterative protocols run, and do trial and error, and that's possible when you have unlimited resources.
Mhm.
Okay, so let's talk about something which is I think more relevant to most of the world, which is when you don't have resources at all or you have minimal resources. How do you go about approaching how to design a smart hospital when you with those resource constraints? And then I think that's something I'd love to know.
Sure. And so one good thing that we have in the present day, let me just say, they did this research and we know this. So when I'm doing a hospital in a
Ah,
small place, there is no need for
you
me
learn
to
from it.
assume that let me just do what's been done before. Why can I not do what they did? There's so much research happening. What I do not see often happening in also in our country's context is that things are not really applied across the board. We can learn from these people and apply them. But that's the fact that's like putting aside, I just thought of it. But
Yeah,
when we think of places, think of both both of you will be very closely acquainted with public health centers in
sure,
Ahmedabad. Think of those places.
sure,
I've been in
sure.
them a few times to get my COVID shots. They were the most dilapidated, just they were just bad. I didn't want to go in them. No one wants to go in them. People have to go in them. That's the thing, right?
Right.
People have to go in them. I can choose not to, because we all have certain kind
Yeah,
of
the
privilege
privilege.
in choosing the
Yeah,
hospitals that we can. People do
sure.
not, and these things are meant for everyone. So it's something as simple as you know, um, sunlight.
Hmm.
These buildings did not have sunlight. You know how important sunlight is in a house. We all know that in COVID. You know how important
Sure.
natural light and air and all these things are. There's a hospital in Rwanda where it sits on the top of a hill. Now,
Mhm.
Rwanda is an amazing country, and it has started to have like good infrastructure, and but they do not have good hospitals. What this hospital does is that what they did is they put all the patient rooms facing the mountains, and They did not
Wow.
just make the normal, because you know how government things work. They just put whatever they want, right?
Put
They
everything
thought
in, right?
about, you know what, we have these mountains.
Yeah.
Let's just open, and they
More
oriented the
fun.
building in a way that you do not need AC, because the winds that blow through that site go through the building in a way that there's lots of natural ventilation, wherein you do not need AC. Now, also, they
Unbelievable.
went one step forward. When you know, if I'm on a bed, if I'm a patient, there's lots of things dangling and dangling around me, right? There's the they put they put the beds against the walls, and then they ran all utilities, the oxygen and everything, in a conduit inside the wall. So when a patient is
Wow.
lying on the bed and looking out in the open, there's nothing in between them except the big window and the mountain. And it's a really simple structure made of, I think, brick. Right? There's nothing. You don't really need to have an expensive building. It's thinking
Environment.
It's
about these
forethought.
things.
It's
Yeah.
the thought. I think that's what you're saying, right? It's the forethought. I mean, the ability to be creative, anticipate problems beforehand, and then come up with creative solutions. And if as an architect, if you can do that from a design perspective, like or like from a design end, I think that solves a lot of problems that as us as as doctors and patient and the patients that we treat, all of like it makes our quality of life so much better in so many different ways. I think that's incredible. Wow, that's a very cool insight.
It's a
What do you
fine
think, Mohit?
integration as in with environment, sustainability, and also local needs. I think so. That's what I believe is the future right now. How people are making sustainable hospitals. I didn't know it until you mentioned integration of environment as well.
But
Yeah.
when we think about sustainable, we're always thinking about recycling, right? But in this case, simply as you said, simply by orienting the rooms towards the mountains, you're taking out the air conditioning cost. So you're going to be using that's like that's such a small that's a small a small decision you take at the beginning that continues to pay dividends across the life of the hospital,
Mhm.
Yeah.
right? I think that's very interesting. But I think
And
yeah, go on, please.
yeah,
Yeah.
it's just something like, I feel it's really important, and you and you guys have to chime in. I feel hospitals should be locally, socially, and culturally contextual.
There you
What I
go. Yeah,
mean by that is that they should not look everywhere. They should not look the same everywhere. People should be able to relate to a hospital when you go there. So if somebody from the hinterlands of Nagaland, when they go to their hospital, they should be able to relate to it. It should not look like a hospital that is in the middle of the city in Delhi,
absolutely.
because it's again, it's very holistic. Like when you think about sustainability, like you'll be using and this is jumping back to architecture, you'll be using low carbon materials, you'll be using, you know, natural materials that are local to the site, and all these things that will make it very sustainable, like in terms of design and construction, but also make it really, it'll belong in the place where it begins. And if you make it like that, people will want to go there. If there's something, I know there's so many people in villages, they don't want to go to hospitals because they look like a
Greenhouses, glass
yeah, they look so.
greenhouses.
If you go to like public health centers in villages of India, they don't look good. They're not inviting you. Now you need to make simple buildings, clean buildings. You need to make clean color. You can add things like color. You can add things like natural light. Make really simple places. Make them
But
inviting, right?
I think the government has kind of picked up on that, and I think especially the ones like the public health centers that I've visited recently, I've kind of been impressed with them because some of the things that you mentioned, like with the natural lighting and the colors, especially. When I go to these hospitals, I feel like that change has started. But again, I'm living in Ahmedabad. I'm not living in the
Yeah.
most like I don't. There's a very strong bias there, and I'm sure there's a lot of work that still needs to be done. I see things changing definitely, but I feel like I think I want to expand more on like the what you just said about the hospital needs to belong to to the not only to the location, but it also needs to be relatable to the people that it's serving, right? Because if you like, I see a few hospitals in Ahmedabad, they look like glass houses here. Now, for a city that has summer 10 months out of 12, If you're gonna make a hospital with a glass facade, you're essentially creating a greenhouse, and that's gonna run. That looks pretty from the outside, but it's gonna run your air conditioning bills through the roof, right? And it doesn't. It has got nothing to do with like how people here have grown up in. This isn't. You know what I mean? So I think if you can talk a little bit more about that, I think I would love to get your take on. Um, I can tell you from a patient perspective, 100%. Like a glass house looks very pretty from the outside, but then that's all it is. Once you're inside, it's the same. But I think when you're an architect, you really have the opportunity to impact the space around you, and I think that's something that I'd love to get your take on.
Yeah, it's like as you said, it's really something that's done because it's a fad to do, right? Glass houses, the fad to do in Ahmedabad, which really makes no sense to me because it is one of the hottest cities that you can live in, and
Yeah,
glass does not belong there. But it is a fad, and so what that does is that, as you said, it drives your air conditioning cost through the roof,
exactly.
and that money that you're paying in air conditioning you could have used in doing like better things for patients, doing better things for your staff, doing better things for the hospital in
Definitely.
general. If it was designed in a better way, if it was designed in a way that belonged to the city, right? Um,
So
and
yeah, go
and
on.
this conversation is not just about hospitals. It's about everywhere. Every building needs to belong to
Mm,
the place where it is. It needs to respond to the site and the context. And there's something called passive design principles, which my work is very big on.
yeah,
Passive design is something where you are leveraging natural things, natural forces to function your houses. So if you think of houses 100 years ago in Ahmedabad, or even 50 years ago in Ahmedabad, say even
right.
10 years ago, everything was passive. Active systems are electricity and air conditioning, and those are active systems. Passive
Right.
systems are windows, like sunshades,
Sunlight, right.
ventilation, the orientation of the building so that wind passes through it. Those are passive systems. And
Yeah.
we've kind of forgotten passive systems because we have the ease of active
Active systems.
systems.
There you go. Yeah.
Yeah.
That's
I had
amazing. That's awesome.
I
Go on.
had a follow-up question. Now, as we can see, like I visited Arab Health last week, actually 3 weeks ago. So the biggest topic was smart hospitals, and it was all high tech. So how does technology really fit into designing a smart hospital from a very grassroots level, okay, to a very roof, like to a higher level, such as the one.
50,000 feet. Yeah.
So that's an interesting. That's something that I feel like as you, me, and as we grow up, like other people, hospital administrators, and everyone would be grappling with that question because it's a cost analysis. It's a, it's about how when you're designing a hospital, like when you're running a hospital, where you want to put it in. But I feel that there's some kind of technology, like emerging technology, that you have to have in a hospital, and like a hospital needs to be a high tech thing in the sense of the word, right? It needs to have all sorts of because it because it exists
I'm sure.
to serve patients. And so when it's forethought, right, and when you put that in the design before, like when you think of everything that like goes into a surgery room, everything that goes into say a lab inside the hospital, when you think of everything that goes in there, and when you because I feel you definitely need to have IT consultants and everyone starting at the drawing board when you're starting design so that
Right.
everything is integrated in a proper way. You don't, it's not that you start a hospital 5 years later, you think, oh, we need to have these machines, and so now we need to run these cables and we need to have these exhaust systems. Everything should be designed in a way that it is scalable and it lasts for a long time
Yeah, yeah.
And
Uh,
at
I
the
think
best
I think
extent you can.
I think to add to that, I think having, like you said, apart from just the design stuff, I think having like a physician consultant or like somebody from the patient, like a patient representative or something along those lines as well. That you even, maybe you don't have the resources to run like a 2-year research study in a warehouse and stuff, right? But like just having a conversation with them, that doesn't cost you anything.
true.
And maybe if you just have a conversation and you learn 3 things and you can make those design decisions on day one, that might lead to a lot of impact going, going forward. It's going to keep paying you back dividends in terms not just of money, but in terms of quality of life for both the doctors and the patients, and of course all the other stuff that works in the hospital day in and day out. I think
Absolutely.
it's just that openness of having a conversation. I think that's something that we need to sort of start integrating into our day to day. What
I
do you think,
think that
Mohit?
that's a very happy having a conversation is the first principle in design thinking, and we
There you
all
go.
can
Yeah,
relate to it, right? Uh,
Yeah.
and my
but I
question
think
was,
yeah, go on.
so what I have realized is all these metaverse technologies, then AR, VR, AI. When I had a conversation with Mr. Viren Shetty from Narayana Hridalia, he mentioned that if it saves cost, then we implemented it. Otherwise, it's pointless because otherwise it does not really help the patient or reduce the cost. Now, how the can you see the future of these technologies such as metaverse, VR, AR being implemented in hospital designs to maybe improve the experience?
That's a difficult question to answer. And a lot of what I say will be conjecture, and a lot of what I say will also be opinions. But I feel because of what I've seen in very expensive hospitals that are designed right now, is that instead of the AI and the sort of all sort of like the
All
all
technological
that
stuff. Yeah,
super high stuff, big hospitals are very much looking to do things that what I said, like, spend the money in doing research, spend the money in things that they know work. They want to get cutting edge machines for surgery. They want to get, laboratories that are like better than the one in the hospital in the next city because they know that these things work. Because if you have a lot of money, you probably won't be doing it for because these technologies, as you said, they're very cool. They're very cool to talk about. They're very cool to learn about. They're very nascent. That's the thing with them. There's a lot of possibilities, but what those possibilities entail, we don't exactly know in the context of giving care, and giving care is a very immediate thing.
but I
Yeah.
And
think
so,
looping back, I think we can loop back to like what you just said, that if we can start focusing on passive principles, like I view AI and all these technologies as active principles, right? They're things that you can integrate into your hospital system, and but it's an addition. It's something that you have to keep iterating, and it's an active integration. I think the priority right now, based on our conversation, what I gather is that the priority is still going back to pass. Like if you have resources, invest very heavily on understanding the passive principles, so that because it's not, the thing about passive principles is once they're designed, you don't have to keep investing in it, or you don't have to. There's no once it's there, it's going to keep giving you dividends. It's like a steady income that that keeps paying you dividends going forward, as opposed to like an active thing that you have to keep iterating or keep sort of interacting with on a day to day.
yeah, that's a good thing you brought up because, like in response, like Mohit's point, like prompted me to think about something that I had looked at like previously, which is a hospital in Netherlands. And there's many other examples like this that you'll come across. And this is one specific one that I'm choosing because I'm remembering that they made the hospital look like a resort, like a spa resort. It's
Yeah,
absolutely stunning. It looks like you want to go there. I want to get sick so I can go there because it's so beautiful. It's nestled in the middle of mountains. There's beautiful like trees all around it. It's in the middle of lush green forest. It's amazing.
we can write your
They spent
prescription. We can
they
write your prescription if you want to get admitted.
they spent so much money on that, right?
Yeah,
Because the person who was designing that hospital, it's a big hospital, was about how good like that the hospitality aspect in hospitals,
I see.
uh,
Yeah,
how important that is for health. Now they could have
correct.
put that money in a lot of like AR and VR and also other things, uh, but they did not because that probably works, doesn't work, we don't know. Like will it work in 15 years? We don't know. But having an amazing bed to lie on and a beautiful view will work throughout. It has worked throughout human
It has
history.
worked across history.
So
Yeah, exactly,
things like
exactly.
these.
Right. It's a bet. It's a sure bet. I guess that's the way you want to put it. It's a better bet right now. It's something we know. And I think
Mm,
AI, AR, VR, these things we
That's
will explore. It's a reality of it's a reality of life, and I think both Mohit and I are going to continue exploring those things as well. But I think we can move the discussion forward, Mohit.
Yeah.
Want to take it forward? Yeah.
Yeah. So, what is the moment you were actually given a project? What's the 4-year time frame from conception to construction of a hospital? How do we get started and how do we end? What are the different stakeholders involved?
So it's a like designing any building and coming up with this is it's a very complex process and a very time consuming process. Sometimes it takes 4 years, sometimes it takes 10 years. Uh, because the thing is this as like in an institution as big as a hospital, there's so many stakeholders. There's the patients and there's the people and there's the community, but then there's the trustees and there's the donors and maybe there's a university who's doing the teaching part of it, and maybe there's the
Mm.
government and then there's emergency services and there's grants and funding and everything. So you have to you have to sort of like
Everybody.
as an architect and as a design team, you have to bring together all these stakeholders, sit at a table. Probably not, you won't be able to, but then you have to sort of navigate all these because everyone has different issues and what they want or something.
Right.
But you need to chart out your basic things, what you want, what is the kind of hospital you want, whether it's a teaching hospital, whether it's a hospital that's serving a big city, it's a small one, big one.
Mm.
What kind of like facilities do you want? Whether it's a sort of a general hospital or whether it's say a pediatric thing, um, because that will govern how it's designed and how it looks and how you want to conceive it sort of conceptually. And the whole initial process probably takes from 6 months to a year before you actually start designing it. When you're starting designing it, there's a lot of more stakeholders that are added to it because we have to bring in people. We have to bring in people who are experts in hospital design because
Right.
designing, there's somebody else who's specializing on designing a surgical room, like an operating theater. We have to bring those people
Right.
in. We have to bring in like landscape
People
people
who do
and everything,
wards. Right. Right. Right.
all those
Yeah.
things, because there's so much that goes on in it. It's a complex beast. And then, so yeah, I think the multiplicity of factors that everything is a tug of war. If you want the
Right.
best thing possible, you have to navigate through it, and it'll take some time. So, yeah, that's a process. You have to go through that. You have to do do like due diligence, like get the people, like what do you want to achieve, and start designing. When design starts, it's a big basic process for any building. So design starts, it goes out, like design finishes, you have a contractor bidding on the project, and then you start construction. Now that might take anywhere between 2 to 3 years through the vagaries of the economics and markets and everything,
Right.
and the scale of it. But that's the sort of the general process on an institutional build, something like a hospital.
And
Mhm.
you also do a
Mhm.
feasibility study initially to know what demographics the hospital suits and the location and what's the
Yeah,
revenue going to come like, I assume.
absolutely. And like this conversation brings to mind two different examples that are so different from what I just told you. Uh, uh, with when COVID was happening, you guys were there saving the world.
Saving the world. Okay.
While we all were locked up in our houses.
Yeah.
There were architects working on deployable hospitals because in
Right.
Ahmedabad you needed temporary hospitals. Every city
100%.
needed a
100%.
temporary hospital. You had to deploy them at the blink of an eye, like in a few days, and they had to house many
Yeah.
many people. So there's also those ends. So I think it depends on the use case. As we said, if you want like a big hospital, say like SVP hospital, where it's going to stand for 50 years and serve the city, that that that's what
That's very
that's what
different.
goes through the process that I just said. And then there's
Right.
these things. It's small hospitals. So it really depends on the kind of hospital that you're designing. And it's completely varying across the board. But the principles that we were talking about previously apply to all of them.
So I think somebody who's not from architecture, if I were to understand this, so there are certain passive principles that kind of go across the board that apply everywhere. Then there's also forethought that you can, and there's a lot of literature out there that you can read and sort of understand about what other people have done and explored and kind of take what they've learned from their expensive research, and we can apply those principles. But then beyond all of that, there's also everything that you do has to be extremely contextual and extremely, it's a case by case thing. That you need to know one, who you're serving. You got to take into consideration the budgets. You need to take into consideration whether it's even possible, where the location of the hospital is, whether you can build something tall or not, whether you can, what kind of materials you want to use. So I mean, I can't even imagine the number of like the different like again coming back to like vantage points. There are so many vantage points that as an architect that you have to look into before you actually like go into say start drawing out, start putting up your first drawings. I mean that's something that's very like how do you manage, like how do you navigate that? Is that just that does that just come from practice, or like do you have to like actively remind yourself that, oh, I have to, I got to think about this, I got to think about that?
Yes.
How does that happen? Yeah.
Yeah, I think it's a little bit of both, right? You have to, it's an incredibly complex profession that I'm just starting to understand. And
Yeah.
what one of the people that I really respect and said architecture is one of the last sort of generalist professions. You're really
Yeah.
not a specialist in anything. The only thing you're a specialist in is bringing people together and then
Yeah.
working with them.
Diplomacy.
That's why when you say
Diplomacy.
like like when you say this guy that's why the term architecture is used in different contexts. Like
Right.
B.R. Ambedkar was the architect of the Indian
Correct.
like constitution, or this guy architected this thing. So because it's somebody who managed and brought together and conceived a lot of different facets and sort of wove the thread through all of them, and then like which then resulted in something that being there. So it's there, and it's an incredibly complex thing to do, which I really don't know the answer for, and I hope to, but like in the later stages of my life. But yeah, I feel like something like a hospital is definitely out there in being one of the most complex places that you can think of. You
Yeah,
know,
I think that's
be it at any scale, a
right.
simple one, a simple dispensary in a village, or a massive hospital on an institutional scale in a big city.
But I was just wondering,
Interesting.
how can a current hospital that has already been built, they're handling loads of patients, let's say
Mm.
Sabardanj or AIMS, India, how can that implement smart hospital design principles? Like, how can you convert an existing hospital into a smart hospital?
And
Yeah.
can you actually do it? Like,
Can we
are
do
there
that?
things that you can do? I mean, of course, there are limitations, and with every hospital, I think both of us understand that. But like, is there something that an existing structure that's already in place? I think
Mhm.
can we, is there something we can do about it?
Yeah, that's an interesting question. That really prompted me to think about how much can be done at places, and I'm assuming in very cost effective ways. So as I
Mhm.
said, like things like nature. The good thing about nature is that if nature, you can bring in nature, right? You can bring in plants, and research that I read shows that even when you bring in plants and you bring in lots of like, plantings and everything, that makes it a very stress-free environment for both the staff and the people. So that you can start with something as simple as that. The something else you can do is the use of color. Really, hospitals don't need to look as drab and boring as they do. As
Right.
as we know, I was looking at a lot of amazing contemporary hospitals across the world, especially in pediatrics, and what they because
Mhm.
they have to deal with
They got to deal
children,
with kids.
and it's
Yeah.
a very sensitive topic, right? So they use they use colorful walls and shapes and everything in the design of the space. What that does, it really makes it for a really playful atmosphere, and which helps navigate to both the children and the staff and the parents of, it lessens that load a little bit. Why can we not put those things into like current hospitals where you certainly cannot demolish and like blow in a window, but you can change the colors. You can bring in more warm lighting. You can bring in natural lighting. You can bring in plants. It's something as simple as that.
I'll tell you why. Because I think when it comes to kids, everybody is very sensitive and everybody is like, okay, yeah, we're gonna make it comfortable and all that. But then when it comes to adults, people just forget that we're just older versions of those kids. Like if you were to give a chocolate to a 5-year-old, a 15-year-old, a 25-year-old, or a 35-year-old without prompting them, all of those people are gonna be happy. Nobody's going to be sad because they received it. You know what I mean? So it's like I think it's more about remembering that, okay, if you can make the quality of, if you're taking these steps to help kids, we can, with a little bit of forethought, take some steps to make the life of the patients that are older also better. And I think Mohit and I are gonna probably tie up with some plantation or some farm in the future. We're just gonna have like 15 plants being
That's
delivered every week. Every week
landscaping,
we're just gonna be
hospital
handing
landscape.
out exactly. We're gonna be handing out like plants to every patient we come across.
But that will actually make a more
I
difference
know,
than what you can think of, because
I know.
it's
I agree. And that's the thing. It's counterintuitive, right? It's counterintuitive. Most people think that you just want to sit across a patient and listen to them. Yes, that is important. But then when like from this conversation, that's what I'm gathering. If you're thinking about even if you think about lighting, right, and plantations and colors, all of that, those are things that I think, again, like you said, we can incorporate, we can make changes. And I think that's it's a pretty nice thought to end on. Is there anything else you want to ask, man? What?
No, I think so, Sharan. You can continue with the conversation.
No, I
There's a
think
lot to
we've
discuss about this. It'll be like
I
a
think
four-part series.
let me like, as we're talking about these things and small things that we can do, let me like, I know we are coming to the close of our time, but
yeah,
let me end bring to you and bring to your attention a project that I feel
yeah,
will be familiar to a lot of our viewers, and it's
sure,
because it won the RIBA like award, which is
sure.
the Royal Institute of British Architects Award. Like, it's given every 2 years to a project, and
Nice.
it's one of the most prestigious prizes that you can get in architecture. And it was awarded to a hospital project in a village in Bangladesh. It's called the Friendship Hospital, and it was designed by the Bangladeshi architect Kashif Chaudhary. Now, this hospital is there in rural Bangladesh, and it's there to respond to the communities and their issues of lack of access to vital resources and poverty and climate change. It sits literally at the seashore in the middle of fields that were submerged because of water level rise. So you can imagine the problem that this
Yeah,
neighborhood is dealing with. Like, it's
unbelievable.
insane.
Yeah,
It's extremely poor. The fields are submerged because of climate issues, and this hospital exists there, right? It's a beautiful building, very small building. I feel it's about 30 to 70, or no, maybe 30 to 40 like inpatient beds. It's divided into
okay,
two parts with a canal of water. Now, there's this building is surrounded by water, but
Oh,
there's no water
okay.
to drink because it's all polluted water or
Salt water.
seawater.
Right,
So
right.
this building harnesses natural water in the monsoon and then stores it for the whole year to come. That canal, when you do that, because that's a very common thing, that's everywhere in sort of the subcontinent, right?
Right.
But what they did is they made a beautiful canal that literally flows through the middle of the hospital, dividing the inpatient and outpatient facilities, so that
Wow.
both of them have a view of that canal as they're sitting in their rooms or the waiting rooms that's flowing through this, which is also like saving water for this hospital.
What is
And
that?
it's created by local artisans in brick. It's a really beautiful use of
That's
brick, and it's amazing. You really should look into that hospital. It's done really simple, basic attention to geometry, basic attention to how wind works, how light works, like, again, no air conditioning, and it won the best building award in the world,
wow.
and it's one of the most important prizes like in architecture.
But
And
again,
you
so I
don't
think
need a lot of funding for that, right?
exactly. So I think there's aesthetics. That's one element, but then there's also functionality. And I think you have to look into both. Like you can't have a beautiful building that doesn't function. And if you have just a functional building that's not, fun to look at, that doesn't work either. So there has to be some middle ground. And I think that's what
Absolutely.
you're kind of proposing, that,
Absolutely.
it
And
has
there's
to
two
be both.
more things that I feel this building
Yeah.
embodies that I really want to touch on, that are important in hospital design. It is paramount. It's like it's important in any public design, but especially in hospital design, in the design of care, in design of
Yeah.
people, which is dignity and empathy, right?
Mhm.
Right.
The spaces that you are in for treatment of the sick, they should be dignified. You should feel they should be respectful of the people that it's serving there. And they should be empathetic when you're designing the spaces,
Yeah.
when you're working in spaces. You should be empathetic about it. Lights and bring. You want to do. Why do you want to do all these things? Because you want to provide some sort of dignity to the people and be empathetic because they are, hurting. They're ill. They want to get better, and that's why they are inside the hospital. And
Correct.
that's where you can start. And then after that, we have amazing people like you guys who can take over and save our lives. But we can start by making better spaces, right?
I
So that we
have
can
a
work in conjunction for good health.
I have one last question. So recently, what I've noticed is there's a trend of the word phygital, where they're merging the
Digital.
digital with the physical experience to improve to improve engagement in general. I'm just wondering, what are your thoughts in patient care? Example, One Health. That's what One Health does. One Health got acquired by Amazon. So they have really human-centric design with very good lobbies. The patient just schedules the appointment and he comes into the clinic, improves the workflow. So I'm just wondering, is it a good approach towards healthcare in the future? That's about it.
It's interesting. What was the term?
Digital,
Digital.
physical
Physical.
I
plus
kind of
digital.
I,
Yeah.
I I laughed out loud when I first heard it, but then I'm like, okay, this apparently this is something that's picking up. So I'm like,
Yeah.
okay,
Yeah,
Physical.
Sharon, what's your take on it? Like, what's your take on it?
what's
I
my
I, I
take
have
on
absolutely no. That's crazy to me. I mean, like it's a cool
my,
thing.
that? See, there you go. That's my take on it. It's very cool,
Yeah.
right? But if, I need to like as a patient. So the way I look at it from like a scientist, point of view. That okay, what's the standard of care right now? What's going on right now? And then if this is a new approach, what's the delta in terms of patient experience, in terms of is it helping me in any way? Is it making my life more convenient in any way? Is it less expensive in any way? Or if it's more expensive, is it more convenient? And am I going to pay for that? Right. So the way I approach all of these technologies, whether it's AI or ML or digital technology, the digital approach
Digital.
to healthcare, I think to me, it has to somehow beat standard of care. And if it doesn't and it's just cool, then if it can bring in like marketing money, if it's marketing money, like I can put out digital and then that draws in patients, great.
Yeah.
That's
Yeah.
one. I mean, that has its own advantages, but from a patient point of view, I think there has to be some delta, you know, rather than I don't want boards around Ahmedabad saying our hospitals are now digital, and then when you walk in and it's actually more
It's more lucrative to
it's more
actually
difficult.
get
Yeah,
care.
exactly. It's actually more difficult to get the care because of the way the digital system that designed. Humans are tactile. We're not we don't on a very personal level. I can tell you this: the more the more things go digital and the more artificial you get, the more you're kind of going away from how human beings are programmed to live or have been programmed to live for so many
Programmed
years.
to live. You're using a,
Yeah,
a very
I
technological.
but you know what I mean, right? Like, I mean, and I think that's what it just comes down to. Is there a delta? And if there is it significant enough for me to shift?
And
That's
what's
it.
the metric that we can use to make that shift?
I wonder.
Like money, like one is of course expenses. Is it expensive? And even if it is expensive, does the increased expense justify my experience,
Hmm.
my subjective experience using this technology? Like, okay, if it is digital, that's great. Does it have, so one is experience, and experience also has two facets. One is the absolute, which means am I getting better care? Do I have access to better doctors to this model or not? And number two, is it convenient for me?
Yeah.
Like I'll give you an example. I'll give you a very simple example. There's some, when you get an MRI done, for example, one of the biggest problems is you're stuck in a closed room with a machine that's humming for 20 minutes, and it can get kind of distressing, and you're not supposed to move. You're alone. It's cold in there. It's weird, right? So
Right.
there's an entire new class of MRI machines that's coming out that basically reduce that time from 20 to 7 minutes, right? Now, is it expensive? Yes. Is the technology newer? Yes. I don't know if it has a better resolution or not. That's not something I'm aware of. But will I pay a little bit extra to get out of that room faster? Yes, I will. So that is a technology that I want to invest in. You see
Yeah.
what I mean? It has to work. The point is it has to work. That's the point.
Your delta should be very
Absolutely.
good enough to implement that.
Yeah.
Correct? Absolutely right. That's what
Maitre, what do you any closing thoughts? I think Mohit and I will never run out of questions, but we need to do justice
yeah.
to to
This is
the
To
podcast.
time. No, absolutely. It's I feel there's so much things to think about with technology, but what I go back to is that with how care works and with how humans work, I feel the digital is less important in terms of patients as the importance of the person is, as the
There
importance
you
of
go.
something like nature is. And I want you and Charan and Mohit to be caring for me, and I don't want to talk to digital screen. In my university, there's things that you sign in and like
Yeah,
when you want to go talk to someone. I hate that. I'd rather just talk to a
there you go.
receptionist who's going to be like, oh, you can wait for 5 minutes. So
There you
it's
go.
much more simpler. I want my doctor to use all sorts of
Yeah,
technology. I want them to use like patient management systems, and I want them to use the newest like MRI machines. But it kind of feels like I feel when it comes to facing the patient, be it in terms of the structure, be it in terms of care, it's anything that's more empathetic will be better suited than something that's digital.
that's right.
awesome.
That's right.
I think we can close on that. Thank you so
Yeah.
much, Maitre,
Thank you
for
so
being
much.
on.
It was
And
amazing to talk to you guys, Sharan and Mohit, and I'm very very happy to be on this podcast and hope to talk to you again soon.
I'm
yeah,
gonna
we will. I think we will.
We have much to talk about.